that frustration, Dr. Stephen Pohlhaus, a dental sleep expert in private practice. Good morning. Thanks for being here.
Good morning. It's great to be here.
I'm starting with very basic. What causes snoring?
Snoring is basically when the tissues in your throat close down while you're sleeping and the air has a little trouble passing through and makes noise. So the tissue just starts flapping around because it's relaxed. So it's relaxed muscles. We want to always distinguish that from sleep apnea, which is a more severe medical condition, which most apneics snore, so it's very important that we make that distinction in treating a snoring problem.
How exactly do you diagnose sleep apnea rather than just regular snoring?
Yeah, the gold standard is a sleep test at a sleep doctor, sleep physician, or pulmonologist. In my office, if a patient comes in with a complaint of snoring, we'll send them home with an overnight pulse oximetry test just to screen them, and if it looks like they have apnea, it'll show their blood oxygen going up and down. We'll get them off to the sleep doctor for a workup at that point, because it's important to get that cleared up before we treat them.
Are there certain things in your life that can cause you to either start snoring, because some people don't snore, they don't know they snore, and then all of a sudden they have that problem?
Yeah, I mean, snoring does worsen with age in a lot of people because, like the rest of our body, things get softer and weaker. So it does come with age. Weight can be a problem too. Excess weight around the throat can cause the tissues to collapse. Drinking can aggravate it, things like that, or sedatives, certain drugs. So lots of things can aggravate snoring, make it worse.
And it seems like there's so many things on the market to treat snoring. What are some things we can do? Well,
there's a few things. Like I said in the beginning, we make sure the patient, if they have apnea or not, it's very important not to treat an apneic just for the snoring, but the treatments are very similar.
Okay.
This is a CPAP machine, which
it's quite a contraption.
Patients that get diagnosed with sleep apnea do, and it works very well. If you can wear this, we recommend you use it. It also will control snoring, but typically not given for that. If you're just snoring without the oxygen loss, they don't give you a CPAP. But it works very well. The main problem is it's very hard to wear.
Do you have to wear it all the time?
While you're sleeping, all night. And a lot of patients have difficulty tolerating the device. Probably a third of your patients will fail on that and need another sort of treatment. So that's where the dentist comes in, which is my job. So this is the first line of defense, and this works for both snoring and apnea. It's called an oral device for sleep apnea.
It almost looks like a retainer or something.
Yeah, it's very similar to like an Invisalign style retainer, and there's straps on here, and this basically pulls your chin forward, just like if you ever taken CPR and you do a chin lift to open the airway. That's all we're doing, and this pulls the chin forward. Highly effective. It's considered equal to CPAP in mild to moderate apnea and for what we call primary snoring, which is non-apneic snoring.
What about those little strips on the nose? Are those the real deal?
They help. They will open up the airway. There's also a thing now called a Theravent that actually goes in the nostril that can help. Another treatment that we have available now, this is a little laser handpiece that we use. We have lasers in my dental office that we used to do fillings and surgeries and such. But we put this device on, which is much less intimidating than what you're used to at the dentist. But what it does is a laser beam that comes out, and we treat the soft palate to firm up the tissues. It's called NightLase by a company called Fotona. What it does is very similar to wrinkle treatments we would do on the face. Well, not I would do as a dentist, but the whole idea is to firm the collagen that gets rid of wrinkles. By doing that to the soft palate, we can firm the soft palate and reduce snoring without any devices. And about 80% effective. I've been doing it 5 years now in my office. It started in Europe, made its way here by Fotona, and we're having great results with this as well. So there's a whole menu of possible treatments.
All right, good stuff, Dr. Pohlhaus. Thank you so much for joining us. Thank you.